that's the end of my presentation. I've talked a lot about different kinds of issues and concerns. I haven't talked about lots of other stuff which I could have talked about, because what I want to do now is to just generate some discussion from you guys about any issues or concerns you may have. Build on what I've spoken about and talk about your experience. I'm keen to hear people reject my ideas or my thinking about how disasters work and nurses' roles in disasters. So I'm happy to open up the floor if anyone's got any questions or comments or anything else. Yeah.
Just talking about the list.
Yep.
Now that health's gone federal, will they override it and have a health list?
Health is complicated in terms of a response, because from a national perspective there are a number of organisations that are involved in a health response. Department of Health and Ageing has a big play in that. Emergency Management Australia, AusAid, and so on and so on. So there's, at this point in time, no federal type list. But I think there's some things we can do to help clinicians understand what it's like to get on a list, or what kinds of things you need to do for yourself to prepare for disasters. So, for example, if we had it somewhere that said, you need to make sure your passport is current, you need to have these kinds of immunisations. If you're going to this area, think about having a better understanding about this culture. Those kinds of things I think would assist people having a better awareness about what you need to do to be self-prepared for disasters. I'm not quite sure, and I can't make comments about what government's going to do about existing lists and so on, or how they're going to progress that. I'm not sure. But I think a lot of it's about being self-sustaining within ourselves, and in particular I talked about people who would turn up to evacuation centres who are ill-prepared from a health perspective. A lot of it's got to do, I think, with the education that we provide them. So it's important that when people come through your health service to go, hey, make sure that you keep your current list of medications and your previous medical history with a first aid kit and with all your sentimental items that you're going to take in a disaster. Have that with that, because that's going to save a lot of time and effort when they actually evacuate. The first aid kit's an important thing. They only need basic things because we know they're going to do a primary health role, but we also know that communities get isolated. During cyclones, for example, emergency services just bunkered themselves down. They're not going to help the community because they need to look after themselves. So communities themselves need to become self-sufficient. So it's important that we educate communities about that kind of stuff.
During the Queensland flood disaster, I found that when I subscribed and listened to the Queensland Police on Twitter, I found that to be quite a useful resource for information. Do you foresee that social networking will improve how we respond as health professionals?
Social media is extremely important at this point in time in disaster. As you can see on my slide, I'm obviously into social media, so I might have a little bit of a biased perspective. However, Christchurch earthquake was a good example. I knew about Christchurch earthquake about an hour before it appeared in our media, TV and radio. It was on Twitter. People involved in CBD Christchurch were tweeting about what was going on in Christchurch. So we already knew. Perhaps from a health perspective, we could be more savvy about how we monitor social media to pick up these things, because that would give us an hour foot ahead of everybody else who's going to respond to a disaster. I think so. There's a lot of stuff already on about health professionals and social media, how to be prepared, what to do. There's a lot of stuff about whenever I would publish something or present something. So this presentation will be up on my website, where I will then do a tweet and Facebook thing about it, where people can go and have a look at the kinds of stuff that I talk about. And there's a lot of other people doing that as well. So there's a lot of resources around that people can tap into by using social media. I think it's going to become more of the norm. However, we know that, and I'm not quite sure what it's like within Queensland Health, so I can't make comments about that, but I know from within other jurisdictions, hospitals block Twitter, hospitals block Facebook, hospitals block YouTube. These are fantastic resources, and until health realises that people aren't necessarily going to use them to chat to their mate, but may also use them for the benefit of patient outcomes. And with APRA and the National